Hello class. As you can see, my name is Alejandra Jaramillo and I'm gonna present to you this important topic named bone marrow transplant procedure. Stem cells can be found within the bone marrow. Bone marrow is the soft spongy tissue inside your bones that makes blood-forming cells. These cells turn into blood cells including red blood cells, white blood cells, and platelets. Red blood cells contain hemoglobin which carries oxygen around the body. White blood cells are part of your immune system and help to fight infection. Platelets help to clot the blood and to prevent bleeding. During the donation process, donors will be given anesthesia to block pain. If general anesthesia is used, you will be unconscious during the donation. If you receive regional anesthesia, either spinal or epidural, medication will be block sensation of the area. During donation, donors will be laying in their stomach while the doctor uses special hollow needles to withdraw liquid narrow from both sides of the back of the pelvic bone, typically 1 to 4 small incisions. The average time for anesthesia is less than 2 hours. Some discomfort and side effects after the donation vary from person to person. Most marrow donors experience some side effects. Some common side effects of marrow donation include back of hip pain, fatigue, muscle pain, and headache. You might have a stem cell or bone marrow transplant as part of your cancer treatment. It is a treatment for some people with leukemia, a cancer that develops in the white blood cells or the immune system, and aplastic anemia, a disease which results in bone marrow failure. Another one is lymphoma, a cancer of the lymphatic system. It is also a treatment for other blood conditions. Depending on the disease being treated, a stem cell transplant may occur after very high doses of chemotherapy. You might have targeted drugs with the chemotherapy. You might also have radiotherapy to your whole body. This is called total body irradiation or TBI. The radiotherapy and chemotherapy have a good chance of killing the cancer cells, but it also kills the stem cells in your bone marrow. Therefore, the patient's healthcare team either collects patient's own stem cells before they have high-dose chemotherapy or a donor's stem cells. After treatment, patients have the stem cells into their bloodstream throughout a drip. Then cells find their way back to the bone marrow where they start making blood cells again and the bone marrow slowly recovers. During the first weeks after your transplant, you will wait for the transplanted stem cells to begin producing healthy blood cells. This is called engravement. There are two ways to measure transplant success. The first one is when your blood counts are back to safe levels. A blood count is the number of red cells, white cells, and platelets in your blood. A transplant makes these numbers very low from the first to the second week. This causes risk of infection from low numbers of white cells which fight infections, bleeding from low numbers of platelets which stop bleeding, tiredness from low numbers of red cells which carry oxygen. Doctors lower this risk by giving blood and platelet transfusion after a transplant. You also take antibiotics to help prevent infections. When the new stem cells multiply, they make more blood cells. Then your blood counts improve. This is one way to know if a transplant is a success. The second way to know if the transplant was a success is if it controls your cancer. Doctors do a stem cell transplant with the goal of curing disease. A cure may be possible for some cancers, such as some types of leukemia and lymphoma. For other people, remission is the best result. Remission is having no signs or symptoms of cancer. After a transplant, you need to see your doctor and have tests to watch for any signs of cancer or complications from the transplant.